Namaste and welcome to the next lecture of Clinical Ayurveda. Myself Dr. Mayuresh Agte. We were discussing Amla Pitta in detail, and in last lecture I have discussed you the treatment of the first type of Amla Pitta, which is regarding Agrimandya, Amapatti and then fermentation of the food. The second type of the patient what we saw in the practice, which we had discussed previously, that विदाही तीक्ष्ण उष्ण आहार पित्तकर आहार विहार, and then these तीक्ष्ण उष्ण गुणात्मक आहार slowly as the time goes and the hetu seven is continuously going on, they destroy the internal mucosa and there are very high chances of ulcers in these patients. And again, because of Tishna Ushna Gunatmak Hetu, you will find Udaradaha, Chhardi, etc. all Lakshana of Pitta Prakop. Now, in this case, first and very important thing to convince the patient that Hetu Sevan is to be avoided completely. Yes, this is of course this is true about any disease, but in these cases patient has to follow it very cautiously because a very small amount of the hetu in ahar vihar may trigger the symptoms in a very extensive amount. So hetu seven, strictly follow hetu seven. First things, हेतु विपरीत आहार विहार means तीक्ष्ण उष्ण आर हेतु, सो शीत मधुर शीत स्निग्ध आहार विहार to be taken by the patient as a pathya. Now what has happened, there is तीक्ष्ण उष्ण हेतु seven, so there is either ulcers or erosion in the annava srotas. So very simple, that you should give all the patients the madhur shita snigdha gunatmak chikitsa like yashti madhu sariva, which will be pitta shamak in total way. First thing. Secondly, if there is ulcer formed in the patient, what is the ulcer in our terminology? It's a vrana, so treatment will be vrana ropana. So for this, all the Mausavardhak Chikitsa or Guru Snigdha Shita Gunatmak Ahar Vihar and Aushadhi are very important. In my practice, I always give Yashti Madhu, Sariva like Dravya, which are, even Shatavari is also useful, which are Madhur Shita, Snigdha, Mrudu, and which are very useful to heal the ulcers, as well as by Shita Guna if there is any erosion in the mucosa of the annavasrotas, they always pacify it very rapidly. If there is any bleeding because of ulcer or erosion, all these Shita Gunatmak Dravya are very useful to stop the bleeding also. Symptoms like Udaradaha, Utklesha, Chhardi are also relieved by this type of dravya. So in ulcer or erosion, or if there is any small amount in bleeding, this group of dravya madhur shita snigdha mrudu are extremely useful. Now how you will give these medicines, at what time, and what will be the anupan? Now Shitaviryatmak ahar vihar, as I told you, is indicated. So anything like Shita Jala, Dugdha, Navanita are useful. But in my opinion, all these are true, nothing wrong in that. The best anupan for this dravya which I use in practice is Ghruta. Why? Tailam Ghrutam Madhu. Ghruta is the Sarvocha Pittashamak Dravya, first thing. Secondly, it is Shita Viryatmak, so it will be Raktastambha all the symptoms of pitta will be reduced like daha, etc. And ghruta is one of the best vrana ropana dravya. So if we give anupan as a ghruta with this dravya like yashtimadu, sariva, shatavari or siddha ghruta of this dravya, it is a very powerful remedy and patient gets relief in very less time. So in general I prefer and ask the patient to use this chikitsa with ghruta as a anupan. If patient is not able to carry on the his job or etc., then simple water will be the there will be no any other anupan which can be available anytime. So ghruta will be the best anupan on in this type of the patient. At what time you will give these medicines? Aushadha sevana kal. Now see, we have want to heal the ulcer. Okay, so healing comes under the kapha dosh, shlesha sandhani. So that means sandhan karma is required, and that's why I prefer this patient the sevan kal kaphodreke gadyanandam. It means empty stomach. What will happen in empty stomach? The empty stomach, because of empty stomach, there is no any other food. So the whole medicines which we are giving will be occupied in the annava srotas, and they will act more fast and their action will be seen rapidly. So in my clinic I use ghruta as an anupan, as I use anannakal as the Aushadha sevan kal. It not necessarily it is early in the morning. It is early in the morning or any time before food or in between two meals when stomach is empty. So Aushadha sevan kal, use of proper Aushadha sevan kal and an anupan in all diseases, but particularly in the patients of ulcers or erosion, are found to be very effective to give fast results. So for ulcers, ropan chikitsa with ropan dravya like yashtimadu, sariva with ghruta. Now this is true about any ulcers in the annava srotas, because the treatment principle remains the same, whether it is gastric ulcer, peptic ulcer, or ulcers in the intestines because of ulcerative colitis or any other reason. So with Tishna Ushna Hetu 7 patients of Amlapitta, this proves to be the best line of the treatment. We will discuss the other types of Amlapitta which we have seen in as a Nidan in the next lecture. Thank you very much.